Hey everyone, my name is Dr. Roger Saias and I'm the clinical director here at PA Pain and Rehab in Philadelphia. Today I want to talk to you about knee pain. It's a very common symptom that we see after car accidents, after slip and fall type of injuries, and especially after a work-related injury. Very common to have knee pain after an injury, but knee pain is not normal. So before I tell you about some things that you could do right now to determine if you have a problem in your knee, I want you to understand a little bit about the knee real quick. The knee is an extremely complex joint. It's surrounded by a lot of ligaments, tendons, muscles, and we have these things called the meniscus on either side of both knees. We have a lot of ligaments in the back of the knee, and you can see how all the muscles, tendons, and ligaments in the lower extremity kind of either cross over or connect to the knee itself. So if you've had an injury, there's a lot of different things that can be injured. So it's really hard to determine on your own what the actual problem is. But first and foremost, one of the telltale signs that you're having a knee problem that should be evaluated by either us at PA Pain and Rehab or somewhere is that you have pain. So if you have excruciating acute pain after an injury, chances are you damaged something because that's not normal at all. But let's say you injured your knee like 3 weeks ago and you're still having pain and you thought maybe it's going to get better and it just hasn't, and now you're starting to limp a little bit and you're noticing that it's harder to go up and down stairs, it's harder to cross your leg, it's harder to do some of the things that we take for granted after your injury. So again, if you're experiencing pain and now it's prolonged and now it's not going away, there's a really good chance that you're having a problem that needs to be evaluated. The other thing that you can do is visualize and just look at your knees. Okay, even if you know nothing about the knee and it's so complex, you could spend a lot of time studying and still not know all the functions of the knee and how it affects the whole body. But one thing you can do right now is look at your knees. All right, they should be similar in shape and size. So if you're looking at your knees and one knee is bigger than the other knee, something's wrong with that knee. It's inflamed. It's not supposed to be different than the other knee theoretically, especially if you've never noticed that before. You can also just touch the knee. So you can poke around in the front and the sides. You don't want to poke too hard, but you can poke around, and if it's tender to the touch and you never noticed that before, or it feels squishy, or it just doesn't feel right, there's a really good chance that there's something wrong with your knee. You should get it evaluated. The longer you wait and prolong getting the knee evaluated and correcting the problem in the first place, you're setting yourself up for long-term problems, arthritis, degeneration, and loss of function. You know, one of the things that we take for granted are all the things that we're able to do on a regular basis, like caring for ourselves or just the basic household chores or going to work, etc. When the knee is involved in the equation, you're going to notice real quick that it's harder to do the simple things, and that's when you really take notice. So if you're having a knee problem, you should absolutely get it evaluated. If it doesn't feel right or it doesn't look right, chances are there is a problem. So thank you for watching this video. Again, my name is Dr. Roger Saias. I'm the clinical director here at PA Pain and Rehab. Our doctors are ready and waiting for you to call us so that we can take a look and evaluate what your knee problem is. I hope this message finds you well. Hope you have a great day. If you like this video, comment, share it, and we appreciate your time. Have a great day, everyone.